Welcome to another episode of Lifestyle After 5, where we're always bringing professionals to tell you about the journeys and the things that they face throughout their life. Of course, I'm here with my co-host MD Red and the Crypt Keeper Danielle, our lovely
What's up?
professional mortician that's on staff. And today we have with us Dr. Frank Kelly. Dr. Frank Kelly is an entrepreneur and a doctor. He's a chiropractor. So he's here to help us. I know in the African American community, there's a lot of myths dispelled, and a lot of us don't believe in seeing a chiropractor. We heard somebody that got their back popped the wrong way. They don't know if it's worth it or whatever. Well, Dr. Kelly is going to dispel all these myths for us and break it down and let us know why spinal care is important, just as important as health. Well, it is a part of healthcare, but it's just as important as your blood pressure and anything else that could go wrong with you. So, welcome to the show, Dr. Kelly.
Man, appreciate y'all for having me, Ali. Um, so yeah, man, I'm just excited to be here. To be able to touch the community. My whole biggest goal is to get 80% of our Black community under chiropractic care. And the reason why we say 80%, if
Mhm.
80% of people see a new pair of Jordans and they see 80% of the people in the community with them on, guess what we want as
Ooh,
Black
we
communities?
want
We want Jordans.
to.
So I want everybody to have that spinal care. So that's why I'm here. And thank you for helping me serve my mission.
We
So,
appreciate it. Why do you think that there's a stigma, and not even just in the African American community, and in all of the American society, with chiropractic care?
man, so that is a deep question. It's a tough question. And it all revolves around pretty much where the money is, or where the money was, the programming behind what was economical and what could make the government more money from my perspective, right? It's all
Mhm.
different views on that topic, but it all boils down to one. I can say as a professional or as a chiropractor, we're a broad spectrum. We don't do as good of a job explaining what chiropractic care is. We oftentimes broadcast what we do in the community as back, neck, and spinal care, which is much more. I know it's more than that,
Mhm.
and really is truly about giving people health. And so I think that's what the disconnect. Everybody else has their niche of what they do in healthcare, and as chiropractors, we don't like perform together, and so it's easy to break down people when you're not one voice, right? And
Mm.
so I think that's what happens a lot with
Which,
us.
which is kind of shocking because I had the privilege of living in Japan for 3.5 years, and there, massage therapy, acupressure, and chiropractic care it's just built into their culture. They're all in for it.
Yeah, yeah, and see what our community is. The first thing you do if you get a cough, especially me being from the country, my grandma would throw rock and ride down my throat, a ginger ale and a Tylenol, and tell me to sleep it off, right?
Yeah, go lay down.
So it's always a pill, potion, a lotion to fix stuff. We're programmed to take the easy way. And another form of healthcare we don't look at a lot is being holistic, but it's dentistry, right? So you never like look in the mirror and be like, "Oh, I got a cavity." But dentists did a good job of creating that holistic approach where they tell you whether or not you have a cavity, you get your teeth checked because they're the specific professionals that know when you have a cavity. Chiropractic, our cavity is what's called vertebral subluxation. And I'm gonna get into that later, but it's a big
Okay,
word, but that's what we check for. So
I've heard that term before.
you have, see, that means you got some good chiropractors.
Yeah, I had you. You popped me. I felt like Fred Sanford when he used to brag about how Donna used to pop his neck.
Oh
That's the
yeah.
way I felt when you cracked my back. I was
I
like, oh,
I cannot stand the cracking sound. Even if somebody cracks their knuckles, I'm cringing. I'm like, oh, stop, 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 stop.
I'm
Like it
addicted. I
just,
can't get enough of that pop.
oh no,
Like I
I don't
said,
want
once you
that
go to
pop.
Japan and they
No.
start, hell, they pop you with their massage, that acupressure massage they got. And shoot, man, that woman twist me and pop me in places I didn't know I could move. And then she like disappeared. I looked to my left and my right, and I'm like, where did she go? She was on top of my back walking on me. And at
Man,
that point, I was hooked. I felt
I had
like
a
I was
patient,
walking on a cloud.
I had a patient come in yesterday and he was like, "Man, bro, I know you got a massage therapist back there. Hey, you'll get her to walk on my back. I'm like, bro, first and foremost, my massage therapist, she tall. So if she walk on your back, you know what I mean by tall.
Mm.
Yeah.
She walk on your back, you not walking out of here.
It's
You're
not
gonna
just
need more of an adjustment, man. But yeah, so most they love that back walking. So you said you were out in Japan with chiropractors and stuff?
Yeah, I spent 3.5 years in Okinawa, Japan, and so that's how I had knew about chiropractic care, and I had a wreck prior to going to Okinawa, so I saw a chiropractor for a while, but he didn't. He used a little thing. He never really popped me. He always used a little
Yeah.
pin thing that
oh, the
Yeah.
acupuncture.
yeah. Well, it's like it they said it hits the bone. I mean, maybe you can explain a little bit about that because it seemed like it does nothing, but they say it's hitting the bone and moving it before your muscles can react.
And that's to lead into her question that I kind of circled around. So yeah, chiropractic essentially it's not just cracking the bones. That's what we look for. We look for that big cavitation. You know, you go on TikTok and you hear and like
Yeah.
they
Oh,
crunching up soda cans and all types of chip bottles, but chiropractic care is really just the movement of that bone, taking the pressure off that nerve, facilitating health. We use that same instrument in my practice. It's called an orthostem. So, and all that does is it's multiple ways you can, or different instruments, but
mhm,
that instrument, what it does is it creates a specific vibration onto that bone. And as you move your neck and your head into different range of motions, it just moves the bone in place. You won't hear a crack or a pop, but you
Oh.
definitely get the same loving, health fulfilled effect as a manipulative adjustment with the cracks and pops.
Nice.
Could
wow.
could you dive into how neglecting spinal health can affect other areas of your lives?
Oh yeah, most definitely. So I like to say, health starts first in the nervous system. So
Okay.
the first thing is babies, when they're forming, one of the first things that's formed is that nervous system in an embryo, right? Because without that, you can't really, it's no signal for the heart to beat, right? It's no signal to breathe because the brain sends that message down your spinal cord and it goes out between your backbones through those little nerves that come off like fingertips.
Hmm.
Every cell, tissue, and organ, over 3 trillion cells in your body, they're communicated to, and the function is caused through that impulse, right? And so it's super important because if you don't have like a clean nervous system, then you can't be healthy. How can your brain know what to do or tell your
Yeah.
body what to do to be healthy?
Yeah, crazy.
So it's important, very important.
Women that are hunched over and they just like, what do
Mhm.
you call that?
Oh, it's
You
called hyperkyphotic spine, and that's like due to degeneration. It's due to osteopenia. Essentially, osteopenia is the bone loses density,
Uh
and
huh.
women, multiple elderly patients come to me, like that, and
Hmm.
it's not an easy correction, but it's something we can help with strengthening as well as like if the patient uses weighted
Hmm.
exercises, then it builds up their bone structure, so it protects their spine, so they're not as hunchback. Then, you
So is
know,
that fixable? Because I've gotten somebody that passed away in that position, and I'm
yeah,
like, what the heck do we do? You know, like it's impossible. So I won't go into
yeah,
details, but what we did, but we fixed it.
yeah. Dang, don't tell me she was sitting out the
But,
casket. That's crazy.
well, yeah, we won't ask how you fixed that.
but
So
can they go to you once that they're in that incline? I don't want to call it incline, but in that hunchback, can you fix it, or is that just to try to? No, yeah, it's done, right?
yeah, it's done. It depends on where they at. It's
Okay,
different stages of spinal
okay,
degeneration. By the time they get to that point, they
okay.
have what's called like compression fractures. So the bones are broken, it's
Yeah.
brittle. So that's why it's important to come to us, especially for ladies that's postmenopausal, right? To come to us before your
Okay.
bones start degenerating, so we can teach you exercises, so we can help adjust you, keep your spine straight, so that you won't get to that point. and then somebody won't have to, like knock you back down in the casket.
Because that's similar to the question I had when you see people that's got like scoliosis and they twist it over and everything. And it
Mhm.
just seemed like maybe you could just take them and just go and put like a brace on them and straighten them up.
Yeah.
Nah,
So
you can't do that, bro.
nah, you can't. Well, so it is some points. It just depends. Like, so scoliosis is a broad topic. It's
Mhm,
different ways that you can have. Some people are born with vertebrae, right? The bone, your backbone.
mhm,
Mhm.
So some people backbones are misshapen. So one side may be smaller than the other one, and that's congenital, right? Or it
mhm.
doesn't form as much on one side so that it leaves you tilted, right? So that's how God intended for that person to be. Now, what we can do is
Right.
the body's amazing. Anytime you have something going on, the body will find a way to compensate for it, right? So that person,
Mhm.
the reason why they have a curve down here and a curve up here is to keep their head balanced, right? And so the body does that for a reason. So why would we mess up something that was created to be like that? So
Yeah.
what we do is we manage it to its best ability. So what we put the bones back in place where they're out of place. The ones that's misshapen, is still able to be out of place, to be misaligned, etc. And so we put them back in place and we let your nervous system flow. A lot of times, if you ask somebody with scoliosis, when it looks real bad, do they have a lot of pain? And they'll say every now and again, but not no more pain than me or you because their body's adapted to that. And the adjustments, what they do, we help with the muscle tone, we help with keeping the pressure off those certain vertebrae, and we help with just the pure expression of life. So they feel better after the adjustments as well. But we ain't gonna go fixing nothing, that God managed that way for a reason.
So they'll never be able to deadlift ever in life.
Yeah,
It's just over.
I have, I have scoliosis. I had it when I was young.
Yeah.
I still do. So if you ever see me, I kind of like, you know,
yeah,
Yeah, because I naturally
but
sway forward.
that's been past the caskets.
yeah.
I'm trying to like.
So did you have a brace?
So
Did they
clearly,
brace you?
spine plays a bigger role than people
I
know.
did.
So
No
let's talk about
surgery.
prevention. What are some things that we can do to avoid spinal issues?
So one, I like to call it the three T's, right? So those are the three things that cause those vertebral misalignments or those subluxations that I was talking about earlier. And that's when the bones out of place is putting the pressure on that nerve. The three T's are thoughts, which are your emotional stress, right? Traumas, which are like physical traumas, and toxins. That's the nutrients or the chemical stresses that you put in your body. And
Mm-hmm.
thoughts, you ever had a bad day at work or you work too hard, you come in tension. If you got kids or something, they say something to you, you like, boy, get out of here. You smack them
Mhm.
out. I'm just like, you carry that. And so we carry that emotional tension on us. That causes pressure, muscle dystone, and it causes the bones to be pulled out of place. Chemical wise, the chemical stress on your body, just say you go and you eat McDonald's every day and you smoking uh 5 packs of cigarettes and you smoking hookah, getting drunk every day. So what's going to happen is your discs are going to degenerate quicker. And when your disc degenerates quicker, then it leaves more room for one, those nerves to be compressed. And every misalignment that you have, guess what? It's less room for those nerves. So they affect that nerve more. They cause more inflammation and it cause more problems, more pain, and things like that. And the physical stress, like people sitting on a wallet, bad posture, slumping, sitting in the on hanging on the scene with the gangster lean, all that stuff, it throws your body out of whack. And so what we do as chiropractors, we figure out one, what bones out of place, put them in place, and then two, we figure out what are you eating that's messing you up. What are you dealing with that's the mental stresses, the emotional stresses that you haven't worked through, those traumas that you haven't worked through, as well as what type of chemical traumas are you putting on your body. We trace that back to the root cause. As we're aligning your spine, we also work with that just to make sure everything is good. So it's chiropractic is more than just spine and back care. It's a whole vitalistic way or a whole organic, just human way of looking at healthcare.
Like,
I'm glad you brought that up about that wallet because I didn't realize that until years ago when I started seeing a chiropractor, and I walked in and I'm the one who used to. I didn't have a lot of money, but I had like a bunch of cars and different junk in there. And he like, you sit on this thing all day, and he's like, this thing's about 2 inches thick. And he's like, this thing, you sitting there all day, how to shift in your spine. And I had never thought about it like that.
Yeah.
And so from that day forward, I've never carried a wallet in my or anything in my back pocket. And
Yeah.
I think culturally we have adopted it because you don't see. It's not like
Mhm.
the '80s where the bigger the billfold, the bill man, you had to have a big
Mhm.
billfold hanging out of your pocket, as they call
20
it,
inch wallet.
and then keys hanging on your side.
There you go. Yeah. But
Mhm.
yeah.
So you
I
don't
heard
see
you
that.
mention something
Interesting.
about sitting down. Like, what is some stuff we can do while we're up moving around?
So, oh, that's a good question. So, apart from people who or patients I see that sit all day, moving around is really important. Like if somebody has like an active job, it's more so not about people moving around, but it's people doing specific movements every day, right? So if
Mm-hmm.
you're doing the same specific movements, if you're using one hand to like lift something every day and throw it on the truck, so you're creating more muscle tone on one side, and guess what happens when one side is stronger than the other? You got
Mm.
a disbalance. So if you can't compensate for it on the workforce at work, then what you do is you take it in the gym. So you notice, like as chiropractors, what we'll do is we'll notice like disproportions or parts of your body that's out of whack, and we'll tell you, okay, strengthen that other side. And that's something to be cognizant of, is like how you go through
Yeah.
life doing things with one hand. If you're right handed, open the door with your left
Mhm.
sometimes.
Mhm.
Mm. Makes sense. It
Mhm.
makes sense.
That's why we have
Yeah,
so
it
many
does.
people with sciatic
Yeah.
nerve pain
Mhm.
and
Mhm.
pulling. And I discovered that when I was in the gym, like you said, if you do like certain exercise one legged, you realize, wait a minute, this leg is stronger. And
Oh
I discovered, especially working legs, like, wait a minute, my right leg is carrying my left leg because it's weak.
yeah, that's
Now,
true.
what are some
Mhm.
daily routines that you would recommend for somebody that could help maintenance their back until they can get that adjustment?
Man, so number one is what's good. A go-to to me, and I prescribe to all my patients, to tell all my patients to do this. Look into the practice of yoga, right? The
Yeah.
practice of yoga is like comprised of moves that help you with your balance and help you create balance throughout your whole body. So things like cat cows, things like thread the needle, which opens up your mid back, um, other positions, child's position or child's pose, these things decompress your spine and they help with the muscle tone. But honestly, it's no substitution to a good specific adjustment, because when the bones get out of place, if they out of place long enough, you can't really get them back. But to prevent that, once you have good chiropractic care, once you do get aligned, you want to do those maintenance things like lift weights. Make sure you go to the gym. It's good to run, stretch every time. If you send more than three, like an hour a day or 2 hours a day, get up, walk around for 5 minutes, and just keep it moving. Always keep it moving.
Or stand up. The standing, I see a lot of people that's
Yeah,
with the
standing desk.
ergonomical desks and where you stand up.
Yeah.
I
Mhm.
can attest to yoga. I was so proud because I have flat feet, very bad flat feet. And you know how most people can just squat down and just sit down on their ankles, like they like take a knee to sit down, like almost like they're gonna duck walk.
Oh yeah.
I could never do that. And I started doing yoga when I was in Georgia. And I was so proud because for the first time in my life, I can actually squat down now and take a squat and
Oh
stand
wow.
and stay there without being in pain. So
Wow,
And
that's
see,
what's
that's
up,
the
dude.
truth.
Shout out to you.
Yeah.
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 Do it right now on camera.
Let's see it. Let's see it, man.
No, I'm just
He's gonna fall over.
Hey.
Hey, you did
That's what's up,
it.
my guy.
and I can get up.
So, Dr. Kelly, Dr. Kelly, I know mattresses play a
Yeah.
big role, right, in what we sleep on. But from waking up and going to bed, and we all have 24 hours. What should we do to protect our spines, or how can we better, or you know what I'm saying, if we
I got
slipped up a little bit? No pun intended, but you know what I mean. What can we do
So
to
that's the
protect our
number one
spines?
question I get. So the best way to go to sleep is on your back, right? You want to sleep on your back, pillow up under your knees so that your pelvis doesn't tilt. You don't want a bed that's too soft, right? A lot of times it's like, that's the first thing we do. We out of mama's house, we made it. I'm gonna get me a soft mattress and a pillow top. And so you lose
Yeah.
that form fit mattress, and then it allows your spine to drop out. The curves that preserve those vertebrae, they drop out. So you want to do that. Make sure you have a pillow under your neck. Now, if you're a side sleeper, which is hard to change your sleeping habits to go from back sleeping to side sleeping. From side sleeping to back sleeping, but you want to sleep with a pillow between your knees, okay? You want to have a pillow here so that you're not too rounded and your head isn't cocked, so that your spine is in perfect alignment. So you want a thicker pillow that's less plush so that you don't sink into it. If you're a stomach sleeper, then that's just, I can't help you.
Dang.
And be right.
And I sleep on my stomach.
So you
I sleep on
cocked
my
up
stomach.
like,
Yeah.
there you go.
I
So
Yeah.
mean,
actually, for stomach sleepers, what you'll do is you'll put a pillow under your hip girdle, so right at your waistline, and you'll try. They make stomach sleeping pillows that like kind of egg crate your head,
Uh-huh.
so that you don't sink too far, or you don't turn your neck and put too much pressure down your the neck and the nerves on the side of your neck. So those it's different pillows out there, man.
those pillows are not cheap. Let me warn you, because I struggle because with me with the regular normal pillows, it's either too low, and if I stack two of them together, they're too high.
Yeah.
So I struggled, and so I had to invest in good pillows. And man, I spent $200 on my pillow.
Dang.
My pillow go everywhere.
So can I
Everywhere
can
I go, my pillow go with me.
I hear that.
so I have a confession. This is a bad confession. I still sleep on the pillow that I've had
Come
ever since
on
I was
now.
I
8,
know your
and I
back hurt.
cannot sleep. It is when I tell you it is
Yeah.
flat. It has, and that's the only way I can sleep. And if it's somewhere else on the other side of the bed, I will
I
wake
got
up
a question.
looking for it. My mom says it's a
Yeah.
walking
Did you
petri
wash
dish.
that pillow? That's what I
Like,
was about to ask you. Like,
I have, but it's not the same, and I have to sleep on it. I have to sleep with it. Like, I'm about to bring it to Charlotte with me, and you'll be a witness, Ali. Like, I
Oh
have to
man.
have it,
All right, so
but it has no kind of form to
so
it.
that's
put,
It is really
so
flat.
keep
Like,
that
it has no.
pillow as a memento. Put it on the side of the bed or hang it up, nail it to the top, and get you invest in a nice.
But I have 9 pillows on my bed.
oh
I
my
just want
god.
that one, and I have nice pillows.
All
Okay,
right, so let me ask you this. So
that's my
what would you
confession.
tell people that's already experiencing back problems, back issues? Like what's some of the stuff they can do to strengthen their back?
So pretty much, I mean, it just depends. It's case by case. Like it depends on what they got going on. If the pain is radiating down their leg, how far, if they walk and they can't, they're leaning forward. If they got problems like leaning forward and they leaning back, it just
Mhm.
depends. It's case by case. But what I will say is, as soon as you start experiencing that, be on route or en route to a chiropractor. Be en route to somebody to get it checked out. You don't want to go. The more you neglect it, it's not going to get better. It's going to get worse. And so we see it all the time.
So let me get this free consult real quick. So my back only hurts when I wake up. After I'm up, I'm good. But when I first wake up, I have a lower back pain. What you think that?
Got you. So it just depends. So is there any days that it feels worse than it does before?
No, no,
Okay. And how long has that been going on?
man. I get 10 years.
Were you in any car wrecks like 10 years ago? Any accidents, slips, falls?
No, I gained a little weight, you know,
Yeah. So
and I got a soft mattress. I ain't gonna lie.
yeah, there you go. So you sleep on your stomach too, or
Yep.
so that's it right there. We just did it. That's it.
I need to get a new bed
You
and
got
lose some weight.
His copay, $45 for the copay for the consultation. You just took 15
there.
minutes
We
this
go.
time.
We're
Thank
gonna wrap
you.
it up.
They're gonna bill his insurance. He'll get the bill.
Hey,
Yeah.
I see the insurance number. Don't worry,
Actually,
it's worldwide.
it's in. Do y'all take insurance, or is it more depending on how it's
Nah,
billed
so
out, how
this
you
is an
bill it out?
important thing. At my practice, I take insurance that includes because I'm for the community. Remember, I'm out for that 80%. So I take Medicare, Medicaid, Ambetter, Blue Cross Blue Shield, whatever it is, you name it, pretty much. Because I know with our
Okay.
community, your first step is getting them through the door.
Right.
It's them using that
And the
insurance.
money.
Now they find out that like it's cheaper options, like as far as wellness care than paying that copay. But to get them in the door, when they see it, they're like, okay, I'm gonna use that insurance to work towards my deductible. But cash rate is
Got
always
it.
easiest because it's usually cheaper for the patient. Sometimes it just depends. It's patient. Yeah,
Cash
So
is
self pay.
king.
cash is king. That's it.
Yeah. And you don't have to wait, what, 30, 45, 90 days for the
I'm
insurance
telling
to
you,
get to your check,
I'm
right?
right now I'm in Colombia visiting another doc. So I'm about to stop by Blue Cross Blue Shield right now and run up for my money. They owe me some. I'm leaving here with something though.
Yeah.
I hear that.
The environment never leaves you, right? You got that
That's
envy, but
bad.
you still
Still need that
rub on
money.
them.
Is there a good way to strengthen up your spine? Like I told you, I don't know if I'm degenerate or maybe next time you see me, you can let me know because I have that like slightly lean forward.
Mhm.
And is there any way or anything that you recommend to keep the spine strong so it stays in line and don't
Yes.
move in between?
So the number we call that upper cross syndrome, right? That's when your shoulders go forward, tight
Hmm.
traps. You get pain on the back of your neck that radiates around your head, headaches, migraines. That's all coming because of a weak posterior chain, right? So that top part of your back, the muscles in your front, like your pecs, other muscles up there, anterior deltoids, they're so tight that they're pulling you forward. So guess what you do when this is pulling tight? You loosen these up, you stretch this, and you strengthen your traps, you strengthen your rhomboids, the muscles of your back. And what you'll find is that your posture will balance out. And a lot of times people like can't help me fix my posture,
Hmm.
help me straighten up. And they're like, I try to stay straight, but I slump down. And it's because no matter what, if you're not thinking about it, you're gonna slump forward. So you got to strengthen those back muscles to pull yourself up so that it's
I almost need like a strap in my chair to just keep me strapped back like this and,
Yeah.
and, and sitting up. Now, would you recommend? There's always talk. Would you recommend squats?
Mm. So that's a tough question because this squats are good, right? It's how much you squat. Um, it's so easy to mess up, the
Mhm.
ergonomics of a perfect squat, and it's so easy to injure yourself while doing squats. But do I recommend squats? Yes and no. It's like this. It's specific to those persons. Now, body weight squats, you really can't mess that up too
Yeah,
much.
yeah.
If
When you
you're,
got like 400 pounds on the squat rack
yeah,
and your spine is already out and you're trying to balance 500
Yeah.
pounds and go down and come up.
yes, it's rough.
Yeah.
But if you do have perfect form, it's better to perfect the technique on any weight. Don't worry about heavy weights. Worry about making it look perfect. And that's how you protect yourself. And then gradually increase the weight. Don't just jump under it because it's like, oh, I can do this. Don't be he
Yeah.
man. You gotta.
I'm not about that
You
life
get
no more.
folded up like a pretzel.
Yeah.
Right. Are there any tools or equipment you would recommend people to use at home to help strengthen their spine
Oh
or
yeah.
spinal health?
So the most important tool to me is like you can go on Timu now. I'm not plugging Timu, but on Timu
Nothing wrong with that.
Five
and
ninety
for
nine.
$4, what you do is you get some rubber bands, right? They're big gym bands. You can take those
Mm-hmm.
anywhere. If you're going on a plane, you can put it in your luggage. They won't go off. And what you do, you hook them around the door and you just pull it towards you, strengthen that back. You can do curls, all the good things that actually like strengthen your back. So that's a cheap fix. You can hook it around your foot, kick out, strengthen your glutes, take pressure off your low back. So that's my key. That's one of my keys.
Now you had mentioned yoga and
Mhm.
everything, but how does breathing play a role in spinal health?
So breathing plays a role in spinal health because spinal health it all stems from your nervous system.
Mm.
Breath work, one, it decreases hypertonicity or too much tone in your body. So it
Mhm.
takes pressure off your spine. Breath work, I tell everybody healing starts with your breathing, right? Healing starts with your breath. And that being so, if you regulate your autonomic nervous system, which is your parasympathetic, sympathetic nervous system, then you will begin to heal better. And so it's super important that you perfect that breathing. You learn how in high stressful environments how to breathe. We don't know how to breathe. A lot of us, we're breathing up here and we're just congested. And so it's not a good flow of energy, I guess you can say. That's an easy way to put it.
Yeah.
And so we're congested.
Now I know you
Wow.
touched on this a little bit already, but can you explain like how much diet plays a part in it as well?
Oh yeah. So one diet plays a well, a huge part because if you got a bad diet, then you can't heal, right? So it's a lot of studies that show that your body becomes what you eat in aspects of like if you eat trash, your body becomes trash. If you're not putting the right nutrients into your body, your cells, if as they grow and proliferate, then they become just mutated, not right, and then it forms different things, inflammation, you can get tumors, all these things. Studies show that like if you actually restrict or you go on a fast for 72 hours, if it's permitted, like not if you have diabetes or other like comorbidities, because you got to eat, but if you can go on a fast, and over time what you'll see is those bad cells in your body starts eating those first. Because
Mm-hmm.
if you think about it, the first thing that it's going to do is it's going to get rid of what's weak, and that's just nature in general. And so your body is going to get rid of what's weak. So it's always good to fast. It's always good to take time, and fasting being like not eat for a few days, and then just clearing your mind as you do that, work on your breathing, and it's cleansing for your body.
Now you specifically mentioned 72 hours
Hmm.
for fasting. So can you explain that a little bit more? So is that where I don't eat anything, or is that just water, or because everybody got a different
Bread and water.
definition of a fast?
Yeah, so a lot of I that's a tough question, and it is true. And the reason why everybody has a different definition of a fast is because it means something different to them, or what their body needs is something different. What I seem to see is like if you go just say 72 hours, 3 days without eating, your body begins that's when the healing process kicks in. I had a patient
Mhm.
with they were like diagnosed with fatty liver, and they were like, "Doc, I don't want to take no pills." Now, I
Mhm.
didn't necessarily tell them, "Oh, go on a fast," but they were like, "How can I do this in a healthy way?" And I'm young. I'm young. I got a family to take care of. Like, give me something before I go back and get this test that may help me. And I was like, "Hey, you've been eating fried." You've been eating Popeyes, chicken livers all your life. You a country boy like me. You got to clean it up.
Yeah.
And so I was like, go on this water fast with me. We gonna do this together as a team. And it was hard. I'm like, dang, I was trying in the process of getting gains. So I'm like, I gotta cut back. And so we went on that fast, and like the pain that the patient had in the abdomen, it went away. And they felt better, less sluggish, certain things that I didn't know they were dealing with, like fatigue and dry mouth. First day was hard. I got like 10 text messages. So I can't eat jello. So I can't eat this. What
No.
about and I'm like, just water, meditate. And that person had a relationship with God. So I was like, pray, right? And so water,
Mhm.
meditate, prayer, get through this. I'm struggling with you, and I'm taking care of patients. So I'm telling that patient, like, listen, I'm in here working just like you. And 72 hours later, well, actually more than 70, it was that next Monday they came back in. They felt better. They got tested. The medical doctor that tested them was like, "Oh, it's listen. I don't know what we found on the first scan, but the first scan don't look like
Mm.
this next scan. So you doing better." And so ever since then, those patients are the patients that listen. When you change their
Yeah.
lives,
Yeah.
you create that, they're like, "Oh,
Yeah.
okay, I'm locked in." And so that patient hasn't missed. They the first person there in the parking lot. And so
Now, to exercise or not to exercise while fasting?
So that's complicated too. It just depends on the tolerance of your body. Now you can exercise, but you don't want to go out and run a marathon. You want to do brief workouts, not too much. You don't want to overexert the system because you don't want to faint. If you feel dizzy, make sure you don't, that you don't continue. If you feel like anything abnormal, you don't want to do it. But it's okay to exercise depending on what your exercise is. Like if you crossfitting and you doing like a Ironman or something, I wouldn't recommend not having those nutrients in your body.
Yeah, after that second day, and you gonna start the weekend. You won't be lifting, throwing up the heavy weight.
Oh,
That's for sure.
yeah, they're gonna be throwing you up.
I
You
mean,
know.
it might be a good cardio day for those on the day that you fast.
Yeah, most definitely.
All right, so let's talk about some misconceptions or some of the biggest myths that you've heard.
Yeah. Oh, the biggest myth that I've heard. The most common myth is chiropractic is addictive. That's a good one I hear all the time. And it's like when a patient asks me that, I'm like, of course it's addictive. Like when you feel better, you're gonna want to keep.
Mhm.
So, but it's not
Right.
necessarily addictive. The process of getting, you don't get addicted to like, you know, cracking your body, the bones cracking. What you do, what happens is
I do.
I,
I need me a crack right now.
Hey,
Well,
man,
an adjustment, not crack. I need an adjustment
you
right
said a
now.
lot of you done said a lot of suspect things today. We about to talk about it.
Well, if it is, I'm sure the chiropractor can get you off crack too.
dang.
He helped me out. He can
So
crack me and get me off crack.
no,
You got popped in the fan a lot.
so you don't get addicted to it. You just feel what better feels like. So now it's, do you need to feel better? If you know what better feels like, you're gonna
Mm-hmm.
continue wanting to feel better because chiropractic, like it's a lifelong journey. It's not
Mhm.
a fix. If we were just treating symptoms, then we would be medicine, right? And we're
Mhm.
a whole different realm of it. I appreciate medicine. I love, some of my closest friends are medical doctors. We talk,
Yeah.
and I don't negate, like medical intervention if needed. But on the opposite, my friends understand that, like, hey, before I take this pill, I'm gonna do these natural things, so my body's not dependent because I'm gonna fix the system and not just treat the symptom. And most you can ask your medical doctors, like, hey, so if you were in this position, what would you do? Like, would you?
Right.
And most of them, they
Mhm.
like, hey, go see a physical therapist, go see a chiropractor,
Yeah,
So
because
I heard a lot of people say, if you crack your knuckles and stuff, it might cause arthritis in your fingers or whatever.
I've
Is
heard
that
that
true?
too.
yeah,
That
that
is a
Okay,
is
good
that's a
one.
true.
good
With
one. That is a
chiropractic
good one.
bone cracking too,
That's
like you gonna have arthritis everywhere.
Yeah, now so if you people say that, that's definitely a myth. If you crack your knuckles, now what you can do is you can hurt joints if you push it the wrong way.
Right.
Like anything else, it's a healthy way to do it to push take the pressure out of the joint,
Mm-hmm.
and so you can still get that pop or that crack. You can technically you can be over adjusted, and that's why it's important not to let people walk on your spine or people
Uh-oh.
to
Yeah, Ali.
You'll
yeah,
be
because
hunchback.
it's different than what we think. We not like breaking necks or anything, but if you put too much force into a specific joint too much, the ligaments get lax. And
Mm.
when you get ligament laxity, it's no stability, and then it's pretty much the situation gets worse. And so that's why it's very important to listen to the chiropractor's specific care plan or plan of care, because
Okay.
they're gonna tell you what to do to stay healthy, and not to overdo it. So,
I'm glad that was going to be my next question because I think I may have already experienced a little of that because I didn't got adjusted so much now. It's like I just lay on the table. As soon as they put me in position and get ready, I just start popping. It's like, damn, you ain't even touched this thing yet. My back just give up.
but see, that's sometimes that can be a good thing because once you're aligned and you get those adjustments, your body start to hold it, then your body naturally should be able to move. Bones should be able to move, and go back to that natural place. What happens is because of what we do, our work, stresses. those things, they put too
Yeah.
much tone. I mean, they put too much pressure, or they change the bone, and then you have too much pressure on it. And guess what? A chiropractor has to come in, put force into that joint, and free that joint up.
Yep.
So,
So I was told that 2 weeks ago when I got a massage because the massage therapist is like, Diego, you're too tense. You will not relax. Like, relax. I'm like, I am. He's like, no, you're not. He was like, you need to see a chiropractor. I give up on you. And I was like, okay. Because he's like, you're just too tense all over. I'm like, I'm a funeral director. I work in the government. Like, I just cannot, he's like, it's your shoulders. You're carrying everything on your shoulders. And in my head, I'm like, I don't want to see a chiropractor. I might end up paralyzed. They might crack me the wrong way, and now I really can't work. So again, another myth,
and
like
that's
that's what
another
you're,
myth.
you know,
You sure you just need your
huh?
pillow to make you feel okay?
But yeah, that's another myth that we like to hit on. Like if you look at studies done by the World Health Organization, even on WebMD, they will show you that chiropractic care has one. I know my malpractice license or my malpractice insurance is much, much, much more or less. Mine's thousands a year compared to a surgeon's
Oh,
who's tens or thousands a
yeah,
year. And that's
yeah.
because we don't get we don't have those same, problems, or we don't see as much, we barely, it's rare to see somebody get paralyzed, and usually it's not necessarily a problem with the technique or what we did to the patient. It's the fact that we negated to look at red flags, like, is this person on certain antibiotics? Does this person have high blood pressure? So it's about the doctor themselves rushing rather than you know what we do or the art of what we do hurting people.
Yeah.
So, what
Got
do you
it.
think about? Well, I won't ask your opinion on that, but I've seen on YouTube the ring dinger,
No.
where this guy, you know what I'm talking about, where the guy lays in the chair
Yeah.
and they grab his neck and they
Mhm.
pull his neck and they pop him from his, they pop you
Yeah.
from your neck all the way down your spine. It's like
Mm.
you damn near try to pull your spine out of your
They
body.
just
And people travel from all around the world for the ring dinger.
yeah. So
Now
what I
I can see that. Possibly. If anything gonna paralyze you, I can
man,
see the
yeah,
ring dinger.
that's scary because that can't hurt you. And that guy is like, he has credentials behind that. He has the training behind that technique, and he has the confidence to do that. Now, me, I'm not doing a ring dinger on a patient. Like, I know what can happen if it goes wrong, and it's putting too much up the chance. And my whole goal is freeing your nervous system up. And if I can do it with the least amount of force possible, I'm gonna do it that way instead of jerking you. But hey, listen, if that's what you into, because you know,
Now,
Try to get my
What
weight,
is
bro.
what is that? I cannot think of it, but you know how some people can get on the camera and they'll start smacking and they chew the gum and people will
ASMR.
pay to
ASMR. Yeah.
listen.
Yeah.
Yes, they have like crack backing. Like people literally will sit there and
Mm-hmm.
pay you or whatever to crack your neck, and they love the
What is
sound
it?
of that. I'm
Oh
just
yeah.
like, this is.
Find somebody.
I don't
How
know,
do
but you can. I
how
mean,
do
he can
you
make some
find
money.
them?
You
That's
can.
what you gotta lead me to them. I'm trying to get
Yeah,
these up.
Let's
that's a new
go. Let's
business.
we'll get it. I need a cut
I
though, so I'm
got you.
gonna
I
bring
give
it
you a
to you.
10% management fees. We good.
There you go. Got my another
We're
next side
good.
hustle. But yeah, I saw it. I mean, it's on YouTube. People just love hearing that. Knuckles. I can't
Yeah.
stand it. I
Now
cringe.
you mentioned being over adjusted and the muscles getting too lax. Is it any way to strengthen that once that happens?
Oh yeah. Yeah. Most definitely. So ligaments, like any other thing in your body, if you give them the right amount of pressure, if you like preload those joints, you work out, strengthen the muscles around them, those ligaments will restore back to their natural tone, and so they won't be as movable, pliable. So yeah, you definitely just have
I
to.
was I was a little worried there. I was wondering would vinegar and water work for the ligaments?
Yeah,
Hey,
you
man,
gargle, you
I'm
gargle a little bit of salt, you be all right.
Vinegar and water.
You get a water.
Vinegar.
oh shit.
You are you are a mess.
All right. Works
Oh,
on other things. I figured it work
I did a
on
medical.
ligaments too on your
hey
back. You
man,
know.
I can't believe what you tonight,
Just
man.
just rub some Vicks vapor rub on it. You'll be good.
Right.
Now that was a remedy back in the day. Heating pad was that. That was the old time chiropractor. Heating pad and Vicks
Oh,
vapor rub for
Oh yeah, the
everything.
heat pad.
that's true. That's
Now
true.
That's
I
funny.
want to ask, how often should you get adjusted?
So that's a it's dependent. It's a case specific answer. So some people I can adjust them, or they can get checked once every 2 weeks. I got a patient that can literally go a month, and I'll check their spine and maybe one or two segments will go out. I have some patients that because of their stress level, I see them twice a week. It's not necessarily the same specific segments that I'm addressing, but they need that adjustment twice a week to maintain their normal. So it's just case by case, person by person.
What's the most extreme case you've seen?
The most extreme cases I usually always see is car wrecks, like
Mm,
patients after car wrecks. You know,
Yeah.
okay.
that's yeah.
Now,
Where are
So
you
I'm
located?
located in Rock Hill, South Carolina. That's like,
Oh, okay.
well, really, I'm legitly like 20 minutes from Charlotte. So
yeah, south to Charlotte. Yeah,
I'm going to Charlotte tomorrow. Ali, can we take a road trip and go meet
I'm
him?
there.
gonna be in. Yeah, I told you I need my back
Let's
put
go.
back in place. I'm feeling a little
We
tense.
can take a road trip. We can get the GoPro up and go
There we
live. You know what I'm saying? In the car. I
You
got
yeah,
it.
if
All
you in
right.
on
Back on
Saturday,
topic.
let's
Sorry.
do it. We'll
Now,
make it
yeah,
Let's go.
happen.
I'll come in on Saturday just for y'all.
Look at that. Get that money,
Oh,
man.
let's put it together.
Hey,
I gotta get
he
back
didn't say
home.
it
I
was
can't be
free,
parallel.
okay?
I got you. I'll
I got
hook you up.
insurance.
I got it.
I've seen him before. I can vouch for his work. Like I said, he's cracked me.
Oh, you've
Yeah.
seen him?
Yeah.
She got
Okay,
excited.
never mind.
She got excited.
I had
Yeah.
no idea. Okay.
Yes.
In the
We
mind.
don't just put anybody on Lifestyle After 5. We
Oh,
everybody's
I
people.
didn't say that. I thought it was a friend of a friend of a friend of
No.
a friend, a brother that
nah,
is a
you
chiropractor.
just a
And we,
neighborhood back cracker.
I
That's
didn't know.
all.
I didn't know he was.
Oh, we put trusted people. Oh, the people trust, just like the people trust us. We bring
I'm
trusted
not.
people
I,
on.
I thought it was somebody Lord Shoe News. My bad.
No.
I'm
And then, yeah, you
sorry.
want your back crack?
Bloopers.
Yeah, but
And another.
the
Never
thing
mind.
is, we look at just getting your back
So confident.
adjusted.
Mhm.
But people don't realize that knees and ankles and elbows and everything else can be adjusted.
Yes. Yeah. So any
So
place that you got two bones connecting that joint, it's a nerve, artery, and vein running between there, and
Mhm.
so we can move all of those.
is there a reason why certain chiropractors, because some chiropractors say we concentrate on full spinal care,
Mhm.
and I guess some are just segmented certain areas. Is it a reason for that?
It's just their viewpoint on the philosophies of chiropractic. I mean, I got buddies that just adjust the top two bones of your neck, and from that, over time, they balance those top two bones. The rest of your spine aligns, and the function is coordinated. I got some people work from the bottom up. Uh, me specifically, I move the bones that's out of place. So if I'm gonna check pretty much the full system. I find something out of place, I'm gonna go to the one that's the primary cause. I'm gonna fix that, and then the rest of them I'm gonna put back in place. Make sure that your body makes the correction and that you heal from the inside out. So when I put them in place, all I'm doing is facilitating that healing. Your body makes the adjustment and heals. So I'm just
Now, the other question I have is about the table. I've always been curious on the table, how the table lifts up and then you push them back down, and it's like, "Well,
yeah.
what are you doing?"
Yeah, so that drop is set just so we don't have to put so much force directly into your spine, and vice versa. When it drops and we press it, every time you put that force into somebody, it literally goes back into our body. So it's like,
Oh.
when you punch somebody, you know how you feel the
Mhm.
reflex
yeah.
back, and so the drop protects you and me, and so that's what the drop is for. It's good. I
Wow.
love the
Okay.
drop.
I was wondering on that.
You a habitual chiropractor.
Yeah, he is. You need to go to school for this.
I'm telling you,
Like, I'm gonna sponsor you. Matter of fact, let's go, and I'll help you open up your practice. Y'all join forces.
I got you.
Hey,
But you see,
anybody
Might
willing to
be a
go now?
receptionist or something in that building.
that's good posture. I see. I see. You've
Yeah,
been
I
doing.
was
he does.
I lived in Japan for 3.5 years.
It ain't
You
no
get
limping.
addicted to things, like for instance, walking on rocks. I do weird things like that.
Do you walk barefoot too?
Not on these streets.
No.
Oh, okay. Some people do.
I'm from the country, but I ain't that country no more.
A
My
lot of
feet,
fast food on
it's too hot out there. I mean, 100-degree pavement. These feet ain't made for that no more. But I
No.
will walk in the grass. I will walk on the grass. But I have like a mat that I ordered off Amazon. It's got rocks, and I got house shoes that slippers that have rocks in them. Put in it. That's yeah.
That's kind of like a massage of your feet or whatever.
Yeah.
And do they teach y'all reflexology? Do deal with reflexology as a chiropractor?
Nah, we don't. That's outside of our scope. But it's a time and place. I refer out for that as well. And so, but yeah, I have patients that do reflexology, and they get great results.
So, all listeners, now that you know the secrets to maintaining a strong spine, keep the momentum going by checking out our interview on chiropractic myths. Dr. Kelly, amazing interview. Thank you so much for these valuable insights.
Thank you
So,
guys for having me.
I'm coming to see you on Saturday.
All
Yeah.
right.
But everybody, listen, y'all need to start taking advantage of these daily things to do that.
Yeah.
Yeah,
We got
it'll
to.
save you. It'll save you from limping and your knees hurting and aching and everything. This has definitely been
Your hips
informative.
hurt.
It
It's
has.
yeah, go get checked out.
Yeah,
I'll let you start with my fingers, okay?
I got you. I got you.
So we're starting with.
That's the spine. She'll get rid of her pillow. Go invest in you a
I'm
pillow.
not. I'm not. I'm 40 years old. No, I'm not. I'm gonna die with that pillow's gonna be in my casket with me.
I know
I'm laying on it.
that pillow brown as hell.
It
Yeah.
mind your
You,
business.
you flip it, right? You
Mind
flip
your business. Listen, it gives me the best dreams. Okay, the best dreams. Anything that's on
You're
it
not
comes
going
from
to
the
that
pillow.
Dr. Kelly, before we wrap up, I want to ask, so what do you think we can do to break the stereotypes and the myth and make, specifically the African American coach, as well as everyone, more attuned to getting chiropractic adjustments?
Okay. I believe it's just give it a chance. Go to look out for the chiropractor in your area. Go give them a chance. Check it out. Get adjusted. It's no matter who you go to, chiropractic works. No matter what technique, if they start top to bottom, bottom to top, give it a try. And then once you give chiropractic a try, it works. Then find somebody who resonates with you. That's and create a friend of the family and just check it out. Just try us. Just try it. You'll like it.
I like what you said. Try one that resonate because you all are not created equal. You will like some better than others.
Yeah.
You're not creating equal. But if you're in the North Carolina area, you know who to see.
Oh yeah.
Frank Kelly.
Tell him
Uh,
we sent you.
yeah.
Maybe he'll.
Tell him, yeah.
You ain't gotta leave North Carolina, hit the road, go travel. He taking all patients from all across the country.
You got a website or anything that you want to give out?
Yeah. So my website is www.expressed with an ed health.com. Instagram, you can follow me at expressed_health spine. And then let's see, Facebook, just look up Expressed Health Spine. And you got me.
Y'all go out there, y'all check him out. And if you in the South Carolina area, even if you in the Charlotte area, be sure to go and check him out. As you can see, the website is coming below us, and it will be in the description link of this video. Yeah, right there. It's up there, expresshealth.com. If you found this video helpful, don't forget to like and subscribe and leave some comments.
Yeah, definitely, man. I love us.
Email us, and we'll be in touch with Dr. Kelly with your questions and your answers. Dr. Kelly, you are welcome on Lifestyle After 5 anytime. Just hit us up, let us know. Being there to get my back adjusted. We're going to see what Danielle's going to do.
Yeah.
I'll pray about it.
Hey, we got you.
If God tells me to go do it, I'm gonna do it.
Listen, hey, listen to the pillow. It's gonna tell you what to do.
I'll bring the pillow with me.
Hey,
Nah,
don't bring the pillow. Leave
I'll
it.
bring
Adjust her and the pillow.
the pillow and I
Adjust the
come
pillow
together.
away from
The
her.
pillow and I come together. Okay, so if you want the pillow or if you want me, you're getting the pillow. It is what it is. It comes with the relationship.
that's a little scary.
Gotta adjust the pillow away from her. But thanks again, Dr. Kelly. This has been our episode. You know how to find us at www.lifestyleafter5.com. And if you're watching, you see the QR code in the upper right corner. You can scan us and join our Discord community where we're always got something going on, posting stuff, and we're communicating inside of our Discord community and always on WDJY 99.1 every Wednesday. Thank you and good night.